Hey skin enthusiasts, Dr. Afton Cobb here, dual board certified dermatologist and Mohs surgeon, and today I'm coming at you to talk about acne scarring and post-inflammatory discoloration or hyperpigmentation. So we probably all have been in that circumstance where you get a pimple, you have some acne lesions or cystic lesions, and you're really excited once it finally goes away and you've gotten it under control. It's a relief. But then afterward, you might be stuck still dealing with some discoloration or hyperpigmentation, or even worse, acne scarring, which can sometimes be permanent. So in this video, I'm going to go over acne scarring, why it happens, what the different types of scars are, and make sure you stay tuned till the end because I will be going through a variety of different treatment options that you can do both at home and with your dermatologist. And as always, make sure to hit the little bell icon so you can stay tuned and get notifications whenever I post new videos. Make sure to hit the subscribe icon so that you can stay tuned to my YouTube community. So the first thing that we think about when we're tackling acne scarring or discoloration is the number one priority is we want to stop the acne from forming in the first place. Because if you keep having ongoing lesions and inflammation, then anything that we try and do to fix the scarring or the hyperpigmentation, discoloration, it doesn't really matter because then you're going to get new ones. So step one to targeting any acne scarring or discoloration is treating the initial acne. So it's really important to work with your dermatologist to get the acne under control early. What's really sad is when people wait too long to come into the dermatologist to treat their acne. For whatever reason, they might think that it's going to get better, or they don't have health insurance, or they're embarrassed, or they don't want to see a doctor. But it's super important to come in and get seen early and get the acne under control early so you can prevent a lot of these long-term scarring and discoloration side effects from acne. So step one, get the acne under control, get onto a good treatment plan with your dermatologist. I'll probably do another video about tackling acne in the future. So once you get your skin under control, you've been working with your dermatologist, things are looking good. One of the first and easiest things to consider is post-inflammatory discoloration. So what happens after the body has inflammation of any type is you can get a residual discoloration on the skin from that inflammation. And basically what happens is you get pigment dropout from all of the inflammation that was going on. And that can lead to what we call post-inflammatory hyperpigmentation, which is like darkening of the skin, or post-inflammatory hypopigmentation, which is lightening of the skin, or you can even get post-inflammatory erythema, which is a red color after having inflammation. And so all of these are just signs on the skin that there was some type of inflammation there before, and it's really common to get this after having acne lesions. So if you've ever struggled with acne, you probably have seen this on your own skin, that for a while afterward, you might notice some discoloration in the area where you had the acne. The good thing about this post-inflammatory discoloration or dyspigmentation is that it does fade on its own with time, usually over a period of 6 to 12 months. So you do have to wait a little bit, but you can rest assured that it will get better with time. People who are particularly susceptible to this are people who have darker skin types, and those people can tend to have more of the residual darkening on the skin. So even more important to get the acne under control early for these people because it can hang around for a long time. But if you're trying and speed up the improvement of the discoloration, there's a few things you can do that help. The first step in improving the post-inflammatory dyspigmentation or discoloration is doing super good sun protection. And obviously as dermatologists, we're always preaching that, but it really is important to helping prevent the darkening of the skin from getting worse, because any bit of UV light or even visible light can make that darkening worse. And so you got to put on that physical blocking sunscreen with zinc or titanium. It's even better if you can get a tinted sunscreen that has iron oxides in it to block visible light, and you got to put it on every day. You got to reapply when you're out in the sun, wear hats, seek shade, because like I said, any bit of light that hits that is going to make it more noticeable and more pronounced. There are certain ingredients that you can look for in skincare products as well that will help with lightening some of the discoloration. You can look for vitamin C products. Tretinoin and other topical retinoids are really good for helping disperse all the little melanin granules, so that helps even out some of the discoloration. And then there's a lot of other ingredients that can help with lightening the skin. You can look for azelaic acid, soy extract can help, licorice root. Those are some just to name a few. If you have more questions about topical retinoids such as tretinoin, you can refer to one of my videos that I've created where I go a real deep dive into all of that. I'll also be creating videos talking about different vitamin C products. I'll make one on azelaic acid, so stay tuned for all of those for more details. But in general, you can look for products with those ingredients to help minimize the discoloration on the skin. The next step when you're approaching acne scarring and acne discoloration is looking at what type of scars do you have. So there's several different types of acne scars, and we might treat them differently. There's ice pick scars, which tend to be little tiny, deeper scars. You can also get boxcar scars and rolling scars. Those tend to be a little bit more depressed, atrophic, and that's where you might see a lot of like textural changes on the skin. Sometimes if you've had a lot of inflammation or been really picking at something, you can even get hypertrophic scars where it gets more raised and really firm. And so the first step is figuring out what type of scarring do we have. Now, if you have hypertrophic scarring where the skin is raised, I see it a lot on the shoulders and the back because they're areas with lots of tension and movement. If you have really thick raised scars, what we might start by doing is using intralesional Kenalog injections, or ILK. So Kenalog is triamcinolone, which is a steroid, and we inject the steroid into the scars and it helps soften them up and flatten them out. It works very well. It can also help if the scars are symptomatic, if they're itchy or tingly or anything like that. Usually I'll have patients come every 4 to 6 weeks and we'll take a look and keep going as long as we're getting progress. For medical people, you really need to use some of the higher strength concentrations of the Kenalog injections to get these really firm, thick scars. And sometimes I'll use anywhere from 20 to 40 milligrams per ml, but you have to be careful because one of the main side effects from doing injections into thick scars is if you do too much, too high of a concentration, or if you injected too much into the fat as opposed to like higher up in the scar, you can actually get a depression of the skin. Like you can almost go overboard and do too much of the flattening and get a depression that kind of can look like a stretch mark. So you just have to make sure whoever's doing it knows what they're doing, and you can kind of start lower and work your way up as you go. So that's how you can treat raised firm scars, which are called hypertrophic scars or keloid scars. In terms of atrophic scars, so depressed scars, there is a lot more different nuances and it can be a little tricky. So in the world of treatments for scars, a lot of times I like to think of it in buckets of what the potential options are you can use. So there's peels where you put a chemical on the skin, and then after several days to a week, your skin peels off and you get like a new layer, and that can help with acne scarring. There's a lot of nuances in using peels, and you want to make sure that you have someone who knows what they're doing, like a board certified dermatologist. Peels that are more superficial, such as like a salicylic acid peel, are going to be more for getting the top layer of the skin, the epidermis, and that can help with discoloration that's just more superficial. When there was an acne lesion, probably like a cyst or something, that inflammation caused destruction of the collagen and the elastin, and when it reformed, it formed this depressed scar. And so in order to get to the level where the scarring problem is, you have to get to the level of the dermis. So the epidermis is the very top layer, the dermis is where all of the collagen is, and so you have to think about that depth when you think about what you're treating for acne scarring. And if you're doing a peel, a lot of the more superficial peels are only going to target superficial problems, so like discoloration and such, but it can be quite helpful. If you're looking to do a deeper peel, you need higher concentrations of TCA or even like a deep phenol peel. But those can be very tricky, sometimes unreliable, so you definitely have to make sure that you're going to someone who knows what they're doing. There's also a method called TCA cross, where you put a very high concentrate of TCA, 70 to 100%, and you put it right inside the scars, particularly for ice pick scars, and that can really help. The next thing that I would think about in the bucket of treating scars is microneedling. So microneedling is where there's tons of teeny tiny little needles that go in and out of your skin, and they create these little channels, and if you go to a deep enough depth, you can get those little channels to go into the dermis, and what it does is it stimulates your body to have the healing process because of those little teeny tiny holes, and it stimulates the body to make new collagen and help improve some of the step-offs with depressed scars. The main thing to know about microneedling is that sometimes it can take several treatments. It's not going to be as dramatic results per se as like a deep laser treatment, but I do like it because it's very safe on people with darker skin types. They generally have less risk of having discoloration afterward, which is a risk potentially with lasers. And so the microneedling is a good option. It's a little bit less expensive than lasers, and it can be quite useful, but usually takes at least 3 sessions. The next bucket of treating scars I would think about would be lasers. So you can do deeper lasers that go into the dermis and really try and create new channels for the collagen to rebuild and reform. You can do more superficial treatments that just take off the top layer of the skin and can help with the discoloration. Again, I would go to someone who's trained in cosmetic dermatology, who actually did an additional fellowship to focus especially on doing these cosmetic treatments in the skin. They're going to be the ones who are best able to take care of you. Resurfacing lasers are probably one of the most effective ways to treat acne scarring. When you think about lasers, there are many different types of lasers out there. There's different wavelengths, there's different ways of pulsing them, and so you can have a lot of variable different results and different goals that you target based on what wavelength you use and what settings you put the laser on. So for acne scarring, a lot of times what we're using is a resurfacing laser. Within the world of resurfacing lasers, there's non-ablative and ablative lasers. Ablative lasers completely basically wipe out the epidermis and part of the dermis, and that's why you can get some really nice effects, because you're getting into the dermis, which is where the collagen problems are that are caused by acne inflammation and scarring. So the ablative lasers can help by getting deep into those layers. And within the ablative and non-ablative lasers, you can get fractional and non-fractional lasers. What that fractional part of it means is that they're not, when the laser's going across, it's not just doing the entire surface of the skin. There's little tiny minute areas that are spared, so like in a little grid, and you might have even seen that if you've ever seen pictures of people who've had lasers. You can like see the little grid, and that's because it's a little bit less downtime, a little bit better tolerated, might be slightly less efficacious, but you can talk with a cosmetic dermatologist about what might be the right treatment option for you. Besides resurfacing lasers, there's also lasers that you can use that target the redness of scars, and what we use frequently is something called a pulse dye laser, or PDL. Pulse dye laser can be very helpful for removing some of the discoloration that comes from the blood vessels in the scars, making it look more pink or more purple. Another treatment option if there's depressed scars is sometimes we can actually add a little bit of filler into those areas that are depressed to try and help kind of pop them out a little bit, and those results can last for anywhere from 6 months to over a year, depending on how much is used, what type is used. So that's another thing you can consider for trying to even out some of those scar types as well. The other technique that's worth mentioning for treating acne scars is using surgical interventions. So by that, sometimes what we'll do is if there's one isolated really bad scar, one that we really can't get a hold of in other ways, sometimes it makes sense to just cut the scar out and put stitches in and let it heal up naturally on its own. So that we might refer to as like a punch excision, where either it's very raised or maybe it's very deep, and we just bring the skin back together after removing that scar so it can heal more normally. Another surgical technique that can be used is called subcision, and that's where we numb up the skin and then we take a needle that has like a beveled angle and we just kind of put it into wherever that bound down scar is, and we use the needle to kind of break up all of the firm tissue that's anchoring it down to release it and kind of pop it up. So that's called subcision, and that's another technique that can be used to help with acne scarring. So just to give you a summary of everything that I talked about, the very first step in treating acne scarring is to make sure to treat the acne itself. You want to tackle acne as fast as possible as soon as it starts becoming a problem so that you can prevent a lot of the scarring. As they always say, an ounce of prevention is worth a pound of cure. Right? Isn't that what the saying is? Anyway, but yeah, prevention is key. Make sure that the acne is better before tackling any of these treatments. The next step is tackling any discoloration, and by that, the best things are doing really good sun protection, because any bit of UV light will make the skin darker. You can look for ingredients in your skincare products. The best one's going to be your retinoids, your tretinoin, because that will help with two parts of the acne scarring. It will help with the discoloration, and it can also help boost collagen production to minimize some of that textural surface differences. Other ingredients you can look for to help with brightening the skin: vitamin C, licorice root extract, soy extract. Sometimes we'll use hydroquinones in certain circumstances, and azelaic acid can also be a really beneficial one. It also helps treat acne to an extent, so azelaic acid is definitely one to look out for. And then if you're ready to bump up to a little bit more effective treatments or treatments that would be needed for depressed scars, you would look for things like peels going to a more medium or deep depth. You look for microneedling, and laser resurfacing is probably going to be the most effective. You can look for pulse dye lasers that help treat the redness of scars, and you can do surgical techniques such as just removing the scar and restitching it, or doing a subcision to break up some of the bound down tissue and release the skin. If you like this video, make sure to hit the subscribe button and hit the little bell icon so you can get notifications every time that I post a new video. Make sure to share with your friends, like the video, and if you have anything else that you'd like to ask me or things that you'd like me to discuss on the channel, make sure to pop them into the comments below. Thanks!